Bismillahirrahmanirrahim. Today we are going to talk about another important mode of ventilation, which is pressure support ventilation. Pressure support ventilation, this is a very nice mode, which is what we call a spontaneous mode of ventilation. The patient starts and the patient terminates the cycle in a respiratory cycle. When we talk about a mode of ventilation, we should discuss the control variable, the phase variable, condition variables, apnea, and waveform. When we look at the control variables in these pressure support ventilations, we do not set flow, we do not set a volume, we do not set an expected time, but we put only the pressure, the ceiling pressure. So the patient should go to these pressures, or the ventilator should deliver air to go to this pressure and sustain this pressure for some time. What time? We're going to see. We set the FI2 and the respiratory rate, no respiratory rate. The respiratory rate that of the patient is not controlled. This is a spontaneous mode of ventilations. When it comes to the triggering, for sure, the patient should trigger the machine to supply or to support him with air. This triggering usually is flow, which is not a pressure anymore. It is a flow triggering. When it comes to the rising time, so when the patient triggers, the ventilator start to deliver by rising time, how fast to go to this pressure. So the flow, accelerated flow, you set a time, shorter time, 0.1 second, 0.2 second, 0.3 seconds. So the flow will go how fast to reach to this summit, how fast against what, how fast the flow against the resistance and compliance to go to reach to this pressure, set pressure. So this is the rising time, and the limit, what's the limit here? This is the pressure, so we go directly to this pressure. And the cycle of termination of inspiration, usually when we start to give a flow, the flow, by inflating the lung, the flow will decrease gradually, and when the flow reaches to a certain level, what we call the cycle of, this is what we call expiratory sensitivity. We set that. This is usually determines the inspiratory time and determines the cycle. And inspiratory pulse, for sure, there is no inspiratory pulse except in the volume control. Beep, we put a beep here. Apnea, for this is a spontaneous breathing, so we should put a backup mode, which is apnea mode in the form of safe pressure controlled mode, and there is no sigh. The waveform is decelerating for sure. When you look at the front panel of the machine, when you look at this is a pressure support. Usually we write pressure support to CPAP. We're going to talk about it when we talk about CPAP. For this is a pressure support. Pressure support, look at this. The patient, you set the triggering. This is a flow triggering. When the patient make this triggering, the machine start to give an inspiration by this rising time, how fast the flow to reach to this level, preset level, this pressure support above beep. So this is the peak pressure in this case. This is a beep. It will be 19. So this is the flow will go to this level, which is 19. So this is 14 above beep. And sustain for how long? When you inflate the lung, when you inflate the patients, the flow decreases gradually to reach to a certain level. This is the cycle is terminated when the flow reaches 30% of the peak flow. 30% of the peak flow, there is termination, no more flow, and expiration starts. So this is a cycle, and put FI2. This is these are the buttons we use. So this is in the pressure support, set the triggering, rising time, the pressure, the ceiling pressure you go, the beep, and the cycle alpha or the expiratory sensitivity. Look at this. This is the pressure time curve. When you look at this, the patient making this is triggering, for sure they should be triggering. This is spontaneous, and this is the rising. So the rising time, this is it is a very short rising time. That's why the flow is very high, accelerated flow, and sustained and reach to the preset pressures, and maintains when to maintain and terminates with and ends. This is ended by this inspiration is ended and start expirations when the flow reaches about, say, we put here the flow is 30% or 35%. This is the expiratory sensitivity, 30% from the peak flow. When it goes like that, he stops. No more flow and starts expirations. This is expiratory flow. This is the expiratory. This is the maximum flow, and this is goes like that. So this is even when you can look at this. This is in here the patient triggered, but here then the rising time is a little bit slow. Instead of being 0.1 second, it is 1 2 seconds or 1 3 seconds. So the flow is a little bit a smaller flow. So it takes a longer time. It takes a longer time to go to reach to this preset pressure. Again, is the resistance compliance of the patient. So this is so look at this flow also. This is this rising flow, and so here in this case, look at the inspirator time a little bit more. It is smaller on because the peak pressure, the peak flow is not the same like that. So this is at 30% or 35% will be smaller. So the tidal volume might decrease. So this is when it comes to the tidal volume for sure depends on this on the driving pressure of the machine, and the driving pressure of the machine. Are going to talk about it, and therefore this is the tidal volume which should be variable. So there's a variability in the flow, variability in the tidal volume, and this is the pressure support. Look at this. If the patient is having pressure support of 20, and the patient for sure the patient is making some sort of effort. This is the driving pressure, which is the difference between the beep and the set type pressure you bought it. So this is different. This is the driving pressure of the machine, and the patient takes some sort of inspiration. He's making another driving pressure. This is the jet pressure. He's making another pressure. So this is the driving pressure. This is an inflating pressure, plus this driving pressure of the patient. The two together gives us this tidal volume. If the tidal volume here, this is if you decrease the pressure support instead of being 20 and became 10, so the driving pressure of the machine is decreased to have the driving pressure. For sure, the tidal volume, the tidal or the volume resulting from this pressure will decrease by half. But the same when you look at this is the tidal volume is the same. This means that the patient is making more effort to compensate for this in order to take the same tidal volume. This is very important. So this is very important in weaning. When you are going to wean the patients, you just come down with the driving pressure. So the pressure support setting of 20 to 10. And look at the tidal volume. The tidal volume is the same. And the same thing also, there is no increase in the respiratory rate. This means that the patient is making good effort. Look at this when we're going to talk about CPAP. So this is no more driving pressure for the patients for the ventilator, but the patient is doing his own driving pressures and the same tidal volume, same rate. This means that the patient is doing good. So that's why in this case I can wean the patient off the ventilator. So this is a very important one. So this is consider when you consider this is a pressure support. Patient is making an effort is a combination of the effort from the ventilator and the patients, and this is gives us the total volume and gives us the change in the volume and the change in the flow. Now this is change in the rising, and this is the RAM rising time instead of 0.15 seconds. This will give you these pictures, which will happen if you increase that instead of 0.15, 0.25 seconds. So this is taking a longer time. So this is a bit more slowly. This is sloping, not vertical like the same thing, the others. When you come to the cycle of, this is a cycle of 27% of the peak flow. So this is what give you this, remember this total volume about 360, which will happen if you increase this one. Instead of 25, it closes on to 40% instead of 27 to 40% of the peak flow. This means the inspire time will decrease, and accordingly the tidal volume will decrease instead of being 360 became 340. So this is a cycle of increasing in this value. This means that you are closing here instead of being at that point 20 30 40. That's it. So this is they are decreasing the inspirator time, and accordingly they are decreasing the tidal volume. You should take care of this point. So what is the reaction of this the ventilator and regarding pressure support with the patients regarding volume, flow, and driving pressure. I've mentioned before that there is a share of the driving pressure between the ventilator and the patient, and this should be considered. And this is considered while you are doing some sort of weaning of the patients. When it comes to the flow, for sure, the flow, this is depends on the resistance compliance, and at the same time on so it will change with the change in the resistance and compliance. And at the same time, if the resistance and compliance are bad, this means the resistance is high, the compliance is low. This means that the flow will be low flow. If the resistance is good, is small, and the compliance is large, this means that the flow will be high flow to reach the same set of pressures. So this is in addition to this, the flow will change according to the driving pressure of the patient. The patient is taking inspirations, and this will make some sort of variability of the flow. The volume, for sure, the tidal volume, this is it is a summation of the two driving pressures. Driving pressure of the ventilator, this is a fixed one, but the driving pressure of the patient is variable, so the tidal volume will be variable according to the driving pressure of the patient himself. When it comes to the inspirator time, this is inspirator time. Sure, this depends on the preset expirator sensitivity you set it, whether it's 20, 30, something like that. So this will determine the inspirator time, and so the inspirator time of the ventilator. But what about the inspirator time of the patients? You have to adjust it like that. This is I'm going to talk about it separately. So you have to adjust the expirator sensitivity in order to make some sort of matching between the patient and the ventilator, and look at this curve. It is overshooting or not, something like that. This is well, you will correct it in order to make some sort of good of matching time with the patient, matching the inspirator time of the ventilator with the inspirator time of the patient, and therefore this is very nice. Oxygenation, for sure, depends of IO2, beep, and deceleration of the wave. So, so to conclude, this is the advantages of this special support ventilation. It is a spontaneous one. It is better synchronizations regarding flow and volume, but you have to adjust for the inspire time. Increase patient comfort, reduce need for sedation, the keys in the walk of breathing, for sure. This is shared between, as I've mentioned before, between the patient, the ventilator and the patients. The keys in oxygen cost of breathing, shorter duration of weaning. So this is the last. So this is SAM for weaning, and after that, convert the patient to the to CPAP, and then wean the patients. Endurance oriented training of the respiratory muscles, deepening of weak shallow spontaneous spontaneous breathing. I think this you should be familiar with pressure supporter, because it is a nice mode of ventilation, spontaneous mode of ventilation, and it is a way to wean the patients before you shift to CPAP. So to conclude, this is unloading the patients is partial. At the same time, the flow is variable, matching the patient. Volume is very much with inspirator time, variable, matching the patient, but should adjust it, and is good oxygenation for the patient. And thank you.